Here's a medical thing they don't tell you. Nutrition is not the most focused on subject in medical schools, at least my medical school. I recall having maybe a few dedicated lectures to it, and even then it wasn't practical nutrition, it was more scientific nutrition. It was basically learning the biochemical pathways of how certain reactions happen as opposed to practical tips like, hey, eating broccoli has been shown to potentially decrease people's risk of lung cancer. Now that I'm doing my hematology oncology fellowship and I'm reading my main textbooks, it's more focused on diagnosis and treatment. Prevention is not as discussed as you would imagine. Personally, I've noticed that when I try to talk to other doctors about nutrition, I don't know if it's a lack of us just not being exposed to the data or if we just kind of scoff it off because sometimes the nutritional claims become too extreme, like, oh, this can cure everything, so it kind of turns us off to actually believing the real science behind things. But I think that's starting to change a little bit. It feels like sometimes when people are talking about how carrots can help with vision, they hear like, oh, carrots can cure blindness. Well, it's like, maybe not to that extent, but preventative eating, just making sure you're eating the right foods from a young age could prevent that. So maybe nutrition plays a bigger role in preventing something from getting too bad as opposed to actually being the cure for when that thing already happens. And that's where I think if the conversation becomes more prevalent, people are more willing to have that conversation about nutrition.